Coach Tess again from Health Diversity, and today we are going to focus on respiratory, hemic, lymphatic, mediastinum, and diaphragm keywords for the CPC board exam. And as I always tell you, take your time, read through the questions, right? Don't rush it. Don't try and book your exam and then you're trying to speed up. No, take your time. Try and learn your keywords. Try and learn it in that way for each section. Each section mind their own business. So you need to learn your keyword per section, just like in respiratory is in the 30,000 section, but it's also there are questions that are coming on the test. So please be mindful of trying to learn each one of them. Every question is important. Every section is important, okay? Even if you get 3 respiratory questions, 1 respiratory question, each question counts. Okay, all right, so let's get right into it. So let me get my book right here. So you have allogenic, you have alveoli, which is an anatomical site. So a lot of the times I put circle around them. That is more of A&P, so you can use that as well. All right, let's look at bone marrow. Bone marrow, sometimes it comes in the same area, which comes with the spleen question, cardiac question, respiratory question. So you have to basically budget your time. Okay, so bone marrow, you have to look at the keywords because most time you get 1 question on bone marrow or spleen. So be careful of, that 1 question that you get. You have to read it question, study those codes, that code set. More than likely you might have 3 sets of codes in that code set. So be mindful of that. Okay. All right, let's look at another popular one. COPD, chronic obstructive pulmonary disease, right here. Right? And it is a number 1 cause of smoking. So you might see that, you might get it on an ICD-10 question. So it might not be in a CPT scenario question. It might be in an ICD-10 question. All right, diaphragm. That is the muscle separating the thoracic cavity. That is there's that, it looks like a board, like a long board that protects your lungs from the lower part of where your heart sits in that same area. It's look like a long, I call it a long board, but that's what it is. It's this flat. It's very flat that covers, separating the abdominal cavity from the thoracic cavity. It goes across. So how the body sets up, so where your respiratory system sets is different from where your digestive system sits. So where your stomach sits behind your heart. So it sits behind your heart all the way down near your digestive system. So it kind of sits right there. So your lung sits on top of the diaphragm. So that's how it works. All right, so you find that you might see like a big word, dacrosynthorhinostomy, this word right here. Sometimes you have to split up the terms. So when you see a big word like this, you don't get scared. Don't get scared. You have to split up the word, right? So if you split up that word, you might notice that it is an ostomy, the O-S-T-M-Y, right at the end right here, O-S-T-M-Y. So with that is a surgical, it is a surgical opening, right? And then you go over the diaphragm, then the synthro, then the rhino. So that's all it is, a procedure that restores the flow of tears into your nose from the lacrimal sac when the lacrimal sac does not function. So those are some of the things. When you see these big words, try and break them up and start work from your suffix. Ostomy right here, O-S-T-M-I, O-S-T sorry, OS, sorry, OSTOMY, that is the suffix. So start looking from the reading it backwards. All right. Direct laryngoscopy. So a lot of the times you might have indirect and direct. So when you look on those codes, pay attention to those two words. So when you read the question, you're going to say, okay, is this indirect or is direct? What do they use an endoscope to look directly into into the larynx, or then you might have a mirror which is indirect. So pay attention, and in that same area look for the operating microscope operating microscope keywords. So pay attention to that. End block, that is pretty popular too. All right, let's go down here. Hybrid bone, indirect, see? Indirect laryngoscopy. So that is where you see right there. Indirect laryngoscopy, use of a mirror with a rigid laryngoscope to view the larynx. What does the term rigid mean? When they're using a scope, the rigid one goes directly, it's like a wire, it doesn't bend. So it's just rigid and it's straight and it goes straight down to the larynx, okay? Then you see larynx, you call it the voice box, right? So it connects the trachea covered by the epiglottis, swallowing to prevent aspiration. So let's look at this thing right here. Now the epiglottis, it works like a gate. So the epiglottis is basically, if it opens up into the esophagus, then you are now looking at food going down into the esophagus, sorry. And then if it opens the other way, is air going down into the air passage. So that esophagus basically opens and closes to let in whatever. So I always tell my students, do not eat and talk. Do one of the other, because that's how a lot of the time people choke. And sometimes you hear you drinking and they say, oh, it goes down to the wrong throat, and so on and so forth. So that's where the epiglottis works. Okay, all right, so let's go to the other section. Let me lift my book up again and let's read this section. All right, the lungs. Now the lungs has 3 lobes. The left lung has 2 lobes. Now, so the left lung has 2 lobes, and the right lung have 3 lobes. So the right lung has 3 lobes, right? And the left lung has 2 lobes. So that's where when you go into that pneumonectomy, that's we're right here. So you might be wondering where I'm at, right here, the right and the left. So that's A and P. So when you're doing that pneumonectomy question, you have to pay attention if it is single lobectomy, bilobectomy, pneumonectomy. How many lobes did they take out? How did they remove it, which is an ectomy. Mediastinum, that's a portion of the thorax cavity between the lungs that contains the heart, aorta, esophagus. That's right in that little area right there. That's the mediastinum. That's the center right there. All right, pleura cavity, and these are layers. So you have the pleural fluid, pleural cavity. So a lot of these things are named after the area that you're in. Pneumonectomy, as I told you about pneumonectomy, pneumolysis, pneumothorax. So if you notice that everything pertaining to the lungs is pneumo, P-N-E-U-M-O, pneumo. So pay attention to that. Pulmonary test, breathing problems. So if you notice that when you go to the heart and they say you're doing a pulmonary test, is air, oxygen coming from that whole area to your pulmonary valve, pulmonary artery that leaves blood from the heart to the lungs. So those are some of the things that you have to pay attention to when we're dealing with that. You have your trachea, the turbinates, or however you choose to pronounce it. I said turbinates, some people said turbinates. However, now the turbinates, these are bones in your nose, and sometimes they get broken, sometimes they have to remove it, all different type of things. And they have the superior, middle, and inferior. So these are some of the things that you have to pay attention to. Septum. The septum is that middle piece in your nose that separates your right nostril from your left nostril. Okay? All right, splenoportography, video-assisted thoracic surgery. You're going to see that as well. Pay attention to that as well. It comes with a guideline. So those are some of the things these are some of the words, or the most popular words that you might see in the section of respiratory, hemic, lymphatic, mediastinum, and diaphragm. And once again, if you just subscribe to our channel, message us, leave a comment, and let us know what you want us to show again. This is a series, so then we're going to be uploading cardiovascular. So look out for that one. That one is going to be a trip. All right? Anyways, I'll talk to you soon. And once again, I'm Coach Tess from Healthyversity.